Hi, Mrs. Bowers. How are you?
Hi, I'm
All
okay.
right, let's go.
Okay,
Got it.
I got it. Watch your toes.
This way, please. This is your chair.
Mrs. Bowers is a 67-year-old female who is a widow and lives alone with her 6 cats. She's a longtime hoarder, a drinker, and she currently smokes a pack of cigarettes a day. She suffered in her past with anorexia nervosa when she was 16 to 21 years old. She currently has an unsteady gait, a hunchback posture. She is 5'2", and her weight is 120 pounds. She's currently taking Tylenol for pain.
So 2 weeks ago, I heard you had a minor fall and broke your wrist. Is that correct?
Yeah,
Okay. Now, and you're coming in for your follow-up checkup.
yes.
I see that your labs are normal, except your alkaline phosphatase level being a little elevated because of your fracture. Your vital signs look good. Blood pressure is 136/82. Temperature is 98.4. And heart rate is 87. So everything looks good.
Okay.
So how did you really break your wrist?
Well, I was going to the bathroom and I fell over my cat. I landed on my arm. And broke my wrist.
Can I see how it looks right now? Let me put this up. Are you feeling pain right here? How do
A
you
little
touch
bit.
it? A little bit. You're taking your pain med
Yes.
every time you need it? Okay, good. Do you have any more pain as of now?
My back's been hurting really bad lately.
Can you rate that? 0
Probably
to 10?
5.
5. Looking at your health history, the risk factors that have contributed to your fractures might have been you're a drinker. Is that right?
Yes.
You drink 3 glasses of wine every day.
Yeah, give or take.
Okay. Maybe you wanna.
Not really, but I guess maybe if I have
Yeah.
to, we'll talk about it.
Yeah. Also, you smoke.
Yes.
How many packs a day?
Yeah, pack.
A pack. Okay. What you do? Also, maybe less than that, or just stop if you can. All right.
That's what they all say, sure.
You also had anorexia when you were young.
Yeah.
That contributed to your fractures because of the low bone mass when you had that. Okay.
Okay.
I saw you had unsteady gait and hunchback posture. Walking without balance is also a reason for falling. Okay. You also live alone. Is that correct?
Yes.
How's your living situation?
That's fine.
Looks fine.
I think so.
For safety, I want you to remove any clutter or rugs so you won't trip.
Okay.
Alright. You also use a cane.
Yes.
You should use that every time you stand up and walk.
Okay, I'll try.
Also said about the smoking and drinking. Want to lessen it or quit? You can.
Okay.
How's your diet going?
I think it's okay.
Okay. What do you eat every day?
Well, sometimes I eat pizza. Sometimes I eat sandwiches.
Maybe
I
you
do a lot
wanna-
of cooking because it's hard for me to stand up for that long. A lot of times I just order food or,
Maybe you want to
I'm
do
tired.
vegetables, fruits, if you can.
Okay, I'll try to
Okay.
do more of that because I don't really like those things, but we'll see.
Right. Do you have any more questions?
I don't-
Concerns?
I don't know, I'm okay.
So, based on the information provided, what would be a possible diagnosis for Mrs. Bowers and why?
Osteoporosis is the main diagnosis for Mrs. Bowers because of the listed risk factors, her presenting back pain, gait, and posture. Also, her laboratory value of elevated alkaline phosphatase contributes to it.
So after about a month, Mrs. Bowers is back to the hospital. She was brought here by ambulance after she was discovered by the neighbor lying on the dining room floor, complaining of right hip pain. So she has had her surgery. And so, Mrs. Bowers, what happened this time?
Well, again, I fell over my cat. I was on my way to the refrigerator to get another glass of wine, and I fell, and I hit my back, and I couldn't move. And the neighbors found me, and they called the ambulance, and
Okay.
I broke my hip.
So, I know that you have had some education, but were you informed that you needed to stop the drinking?
Well, you know, they said that at the doctor, but I just don't think it's that big of a problem.
Okay, well now you're here, twice in less than a month. So,
I know, I see it's a bigger problem than what I thought.
So let's discuss one of the tests that were run. You had a bone mineral density test done.
Okay.
They take that score and they compare it to a normal, healthy 30-year-old adult, and then you get what's considered a T-score. So anything lower than a negative 2.5 on that T-score is osteoporosis.
Okay.
So you scored a negative 3.2. So
Okay.
that's definitely indicative of osteoporosis.
Can you tell me like exactly what that means? Because I'm confused.
So from your perspective, osteoporosis is the bone density, the thickness of the bone has deteriorated, and the more it deteriorates, the more at risk for fractures
Oh,
that you can have. And
Okay.
considering you've had 2 fractures in a month, it's
good.
not good. It's very indicative of an issue. It says that you were anorexic as a teenager. Have those issues resolved? I mean, I know you're 67, but
Yeah, that was just a young person thing.
okay, because that's going to be
Got
very
help for that.
all right. That's very important because the meds that you're going to have to take, and I'll have someone come and talk to you about those in a minute. But we would just want to make sure that whatever that anorexia issue was is no longer
No, I'm okay with that
okay.
now.
All right. So what happens is because you were so young at that time when you had the anorexia, up until your 20 is when your bone density continues to build and build and build, and then you reach that max capacity. Because of the way that you are not eating and not getting the calcium and vitamins that you needed, that kind of predisposed you to this current situation years and years later because your bones didn't get a chance to fully
Okay.
develop properly.
I understand.
So we're going to discharge you to a rehab facility because of the hip fracture, so you've got to get back to mobilization.
Okay.
So I need you to go there first, and we'll have Ashley come in and talk to you about that. Also, I want to get in touch with social services to do a home inspection because this is the second time in a month that you've fallen over a cat. How many cats do you have?
I have 6 cats.
Okay, that's going to be an issue.
I know.
So let's get social services out. Let's see if we can get the house maybe cleaned up. Okay, and have that ready for when you get discharged from the facility. Okay?
Okay.
So I'm going to have Ashley come in and talk about your discharge and then also give you some education on the medications and a change in diet. Okay?
Okay.
All right. So, Ashley?
Hi, Miss Bowers.
Hi.
My name is Ashley. I'm going to go over some discharge instructions with you.
Okay.
How are you today?
I'm okay.
Well, good. You ready to get out of here?
I am.
All right, well, I'm just going to go over some instructions with you. We'll go over them together, and then I'll give you a copy that you can take with you, okay?
Okay.
All right, so the doctor has prescribed for you Fosamax. It is a biphosphonate. Have you ever been on those before?
No, I don't know what that is.
Okay, well, it's a medication that helps to prevent but also treat osteoporosis, by increasing the bone mass mineral density.
Okay.
So it'll help you with the issues you have going. There are some side effects of the medication, which are anorexia, weight loss, and gastritis. There's
Okay.
some rarer but more serious side effects, such as death of the bone jaw. So it is recommended that you see a dentist before taking the treatment.
Okay.
With the medication, you want to take it with a full glass of water, and you want to do that 30 minutes prior to eating and taking other medications.
Okay.
Also, after you take the medication, you want to sit up for at least 30 minutes after administering the medication.
Okay.
Okay? It's also important that you keep up with your calcium intake. For your recommended age is 1,200 milligrams daily.
Okay.
You can get calcium through your diet by things such as milk, yogurt, ice creams, sardines, spinach, things of that sort.
Okay.
If you feel that you're not getting enough through your diet, you can do supplements. The only thing with supplements are that they're harder to absorb in more than 500 milligram increments. So if your supplements are more than 500, you want to kind of divide those doses.
Okay.
All right. Also, for calcium absorption, vitamin D is important. So at your age, you're recommended to get 800 IUs of the vitamin D to absorb the calcium. So those kind of go hand in hand together.
Okay.
All right. I see that you are being discharged to a rehab. Is
Yeah.
that correct? All right. Mobility at this point is very important, but I know with your situation, it's going to be harder for you.
It is.
If you can try to move as much as you can, that'll be great. That'll help with your bone, increasing your bone density, and just building up that bone mass. Repositioning yourself, trying to do range of motions would be good. You definitely want to keep up with your ADLs, which I know is also going to be hard, but please be sure to try to get as much assistance as needed.
Okay.
All right? Any questions or concerns?
I don't think so.
Nope. All right, well then I'll give you this copy,
Okay.
and then I'm going to go out and get your discharge papers together and print it off, and I'll bring them back for you to sign. All
Okay.
right? Thank you.
Thank you, Ashley.
You're welcome.